CDC data show that in New York City, the death rate from COVID-19 is more than double for patients who are Black and African American compared with those who are white. And these are trends that we see across the country. Dr. Lauren Powell is the executive director of Time's Up Healthcare and previously led the Office of Health Equity for the state of Virginia's Department of Health. Dr. Powell, thank you for being here tonight. I want to ask you about a really remarkable op-ed that you wrote in Stat News this week, where you said this situation, this coming together of events, was your worst nightmare. You saw this coming. Tell us about that.
Yes, I did see this coming. As a public health professional and also as a Black woman, my biggest fear was essentially that these two moments would converge together. Understanding very early on the impacts that COVID-19 would have on the African American community, my biggest nightmare was that there would be another shooting of an unarmed Black person and that could lead to massive protests in the midst of a pandemic. And while I understand the anguish and the need and the desire to protest and the underlying root for protesting, this is still a pandemic. And so that is the crux of my worst nightmares. How do we still keep people safe in this public health emergency?
But one of the things you also point out, and one of the things you have worked on in your career, is the fact that these inequities exist in the healthcare system. Have you seen any evidence that this moment is a moment for progress there? We talked with Dr. Fauci earlier today, who said there are both short-term and long-term efforts that need to be made. Do you see any progress that is starting as a result of this?
Well, I think, we can look sort of at the state level, and we have to look state by state to actually see what interventions are being implemented. I am encouraged by some of the work of the Commonwealth of Virginia that has a health equity leadership task force and a health equity work group that is focused specifically on mitigating the health equity impacts of COVID-19 and essentially very focused on ensuring that populations that are under-resourced are getting the resources that they actually need in order to come out of this public health emergency a little bit better.
Well, Dr. Powell, stick with us. I want to bring in also Dr. Paula Johnson, who's a former professor of medicine and public health at Harvard. She's also a cardiologist, and she's currently the president of Wellesley College. Dr. Johnson, thanks for joining us on the phone. You wrote a piece recently this week about a Wellesley alumna who graduated from Wellesley just 5 years after I did, actually, and she died at the end of April from COVID-19. You said that her death tells us volumes. Tell us about Rana Zoe Munjin.
Meg, it's great to be with you. Thank you, as well as you, Dr. Powell. Zoe Munjin was a brilliant young writer and a teacher in Brooklyn and had underlying asthma. And she began to have symptoms, typical symptoms of COVID. Went to the hospital actually twice and was treated for asthma, was quite ill, actually even was told that she might have anxiety, was sent home until the third time when she had to call an ambulance and get to the hospital when she was intubated. And we know that this disease quickly turned from a reasonable oxygen, level in the blood to one that is quite low. And she never recovered. There was a tremendous attempt to get her to transferred to a tertiary care hospital in Manhattan so that she could get on one of the new trials. And with a lot of intervention, actually by a lot of Wellesley alumni, she was finally transferred, but so sadly, she passed away. And it's really a story that is heartbreaking, but not, unfortunately, unusual in terms of women of color, people of color, but I think the mix of sex, of gender, and race is particularly toxic. And the lack of taking people's symptoms seriously, and even when care is accessible, it really not being adequate.
And I know that you both have done work also around gender issues in healthcare as well. And one of the things you wrote, Dr. Johnson, is that it wasn't until the 1990s that women started being included in clinical trials. And that came about after women were elected in larger numbers to Congress after the Anita Hill, Clarence Thomas hearings. Do you see this as that kind of similar moment, a pivotal point in history that could actually stir some change?
This is such an important moment in time when we have seen both issues of sexism and racism and the combination, the great inequities in our society really laid bare by this epidemic, both from a health and health care perspective, from an inequity in what's happening in terms of income inequality and the unemployment rates, and then on top of that, to experience the additional tragedies of the killings that we've seen recently on top of so many others. It's really a coming together of so many insults that it is a moment, I think, a wake-up moment. And we're seeing that, across the country. And as we think about women and women of color and their health status and their treatment, it is a moment where I think there will be a greater call for more active engagement at the tables that make the decisions. And I think that's where we're missing. If we are not at the tables making the decisions about the trials, about the analyses, about the care, about the public health structures, then we are left out. I think about Stacey Abrams' brilliant op-ed today. Voting may not be the full answer, but, the bus doesn't run without the wheels. And, on Tuesday we saw some really positive outcomes, but it's part of what I view in higher education also as my job, which is how do we ensure that not only are we bringing a diversity of students to our campus that we are so proud to have, but that we are working hard to ensure that they learn how to engage across difference, but that they also learn what is it to be civically engaged and to really be an active member of society in a way that leads to structural change.